Thank you so much. It's a pleasure to be here today to support CFTH's efforts to end homelessness in Clark County. I recently published a book that surveys the evidence about how to do it. Let me share some of what we found. The book is organized around 4 questions. Who becomes homeless? What causes homelessness? How do we end it? And how do we prevent it? The first question is who becomes homeless? Over 500,000 people are staying in shelters or found in street counts on a single night. And we know that we miss people, but many more people experience homelessness over longer periods. Over the course of a year, more than 3 times that many people stay in shelters. Back in 1990, early in the current epidemic of homelessness, a telephone survey of people living in regular housing, no homeless shelters, barracks, jails, found that 7% of adults said that they had been literally homeless at some time in their lives. Twice that many if we count doubling up. So most homelessness is a temporary state that people pass through. That gives us many points of intervention. How do we prevent homelessness? How do we help people to escape it? How do we stop generating more? On a single night, there are roughly equal numbers of individuals who are sheltered, individuals who are unsheltered, and families, most of whom, thankfully, are sheltered. Infancy is the age at which an American is most likely to stay in a homeless shelter. Children are a blessing, but they require the parent either to pay for costly care or to stay home to provide that care. Rates of homelessness stay high in the preschool years and then drop when children reach school age and childcare expenses drop. Homelessness rises again in adulthood. Although there are not many people in their 60s and older who are currently homeless, that number has been rising in recent years and will continue to do so. Older adults face severe health challenges. So when we think about the face of homelessness in America, we should think not just about the man on the left, but about the child on the right. Now let's talk about the causes of homelessness. We have 3 powerful pieces of evidence that what causes homelessness is lack of affordable housing. One piece of evidence comes from history. What was going on when the current epidemic of homelessness started? Another piece of evidence is from geography, where rates of homelessness are highest. The third piece of evidence is from what we know prevents homelessness. This slide shows that back in 1970, there was a small surplus in the number of housing units that people at the bottom of the income distribution could afford. But as rental costs grew and incomes did not keep up, that surplus turned into a larger and larger deficit, and modern homelessness arose. This map shows what an earner's hourly wage would have to be in order to afford the fair market rent. That is, rent at about the middle of the market. Washington is one of the most expensive states. For Clark County, in 2020, the hourly wage to afford that modest 2-bedroom apartment is $28.25. This figure illustrates the relationship between housing costs and high rates of homelessness. It shows the largest 25 metro areas in the United States. The left axis is the rate of homelessness, the point in time count divided by the total population. The bottom axis is median rents. You can see a clear relationship here. Homelessness is higher in places with particularly high rents. Clark County isn't quite as bad as Seattle, but it's up there, near the top. This is the final piece of evidence that homelessness is fundamentally a housing affordability crisis. A rigorous study of the effects of providing housing vouchers to families with children shows that having a voucher wipes out risks of homelessness. Among those living in poverty, why are some groups particularly vulnerable to experiencing homelessness? In the book, we discuss this at length, with particular emphasis on the role of racism and social exclusion. Black people are particularly vulnerable to experiencing homelessness because of a legacy of discrimination and also current discrimination. In 2018, Black men earned 3/4 as much as whites. Black women, about 4/5. For the past 3 decades, unemployment has been roughly twice as high for Blacks. This is not a difference in skills and experience. A paired testing study had people with the same education and experience answer job ads, but use names identifiable as African American or not. The study measured differences in the person's apparent race in being called back for an interview. The difference between being Lakeisha and being Emily was the equivalent of an 8-year difference in experience. Wealth disparities resulting from a long history of legal discrimination in home buying mean that Black families are less likely than white families to own homes and are less likely to have a relative or a friend able to provide help in a crisis. Black families were unable to benefit from the accumulation of housing wealth following World War II, but white families were able to pass on from generation to generation. And paired tests that measure housing discrimination, similar to the paired tests for income discrimination or job discrimination, show that it continues, despite the fact that it's been illegal since the 1960s. And then there are disparities in rates of incarceration that were exacerbated by the so-called war on drugs, and the much greater likelihood that people of color would be incarcerated as a result of minor drug charges. People with disabilities have not just the challenges associated with their disabling conditions, but also face discrimination in the housing and job markets. And income benefits for people with disabilities are far too low to afford housing. So those are the causes of homelessness. A housing affordability crisis that is particularly hard to cope with for people who live with the results of social exclusion. Let's turn now to how to end homelessness. Here we have evidence about programs that work for particular groups and also about the impact of broader systems changes. The Family Options Study compared different interventions for families recruited in homeless shelters. It showed that offering families housing vouchers that reduced their rental costs to 30% of their income not only reduced every measure of homelessness and residential instability, but also had radiating impacts. It reduced separation of children from parents. Children's school attendance improved. It reduced behavior problems. It reduced families' food insecurity. For adults, the vouchers reduced domestic violence, psychological distress, and substance abuse. That is, the vouchers provided a platform for families to solve other problems on their own. As one mom put it, for me to actually have a nice house for our children without having to be completely worried about rent for this month, because my husband is trying to go back to school full time and so am I. We know we're supported and we don't have to worry about losing the house because we're trying to go to school and to work and we're safe and we're okay and we'll get things back on track. Further, few families were ineligible for the vouchers, lease-up rates were high, and all these benefits cost only about 9% more than the usual care available in the study communities. Vouchers alone end homelessness for most families. People with disabilities often need more. Supportive housing, which is subsidized housing with services under people's control, ends homelessness for people with serious mental illness and substance abuse problems. The traditional approach here is sometimes called the staircase model, in which people earn their way to more independent housing by addressing behavioral health challenges. The housing first approach bypasses the steps in the staircase model and gives consumers immediate access to independent, permanent housing without preconditions and with the services they choose. There's strong experimental evidence that this approach works much better than the old staircase model. It ends homelessness without exacerbating substance use because services work better when people choose them freely. In addition to describing specific programs, our book discusses the homeless service system and efforts like coordinated entry to make it more efficient and effective. When we make coordinated efforts and put resources behind them, there's evidence that we can end homelessness. We cut veteran homelessness nearly in half with the combined efforts of the Veterans Administration, the Department of Housing and Urban Development, and state and local governments. And we reduce chronic homelessness by increasing the supply and targeting of permanent supportive housing. Finland has largely ended literal homelessness with a concerted housing first approach. Note that the light blue bars, institutional placements, would not even be counted in the US figures. The evidence is strong that we can end homelessness for people who experience it, but we need to prevent homelessness for people on the brink, and we need to stop generating homelessness. Prevention programs are difficult to design well because it's hard to tell who would have become homeless in the absence of the intervention. It's not enough for a provider to say, well, 90% of the people who got my program stayed housed. I can tell you how to get to 100%. Just give your services to millionaires. So bad targeting can masquerade as effective prevention. Every study that has looked finds that you get the most impact by focusing on people with the highest needs, even if you often also have more failures there. We have strong evidence that a few prevention strategies work. As we noted earlier, there's experimental evidence that the same housing vouchers that end homelessness also prevent it for poor families. There's evidence from multiple studies that New York City's home-based program, which is essentially good old-fashioned social work backed up with some cash resources, works for both individuals and families. And although most people who get evicted do not go on to become homeless, there's good experimental evidence that cash help can reduce that number further. There's weaker evidence for some additional approaches. Legal help reduces evictions, but we don't know that it also reduces homelessness. Ongoing rental subsidies, more modest than those provided by housing choice vouchers, prevented homelessness among people with HIV in one study. And universal screening for prevention was part of the full court press that reduced homelessness for veterans. In addition to helping people on the brink of homelessness, we need to change the broader social conditions that are the cause of homelessness by reducing housing costs, raising incomes, and combating social exclusion. The most powerful thing we can do is to expand the Housing Choice Voucher Program. The program has expanded nationally only from 2 million to 2.2 million units over the last 20 years. Vancouver's Housing Authority already sets aside vouchers for people experiencing homelessness, which is great, but we need more vouchers. Our book suggests that adding about 300,000 units a year nationally and focusing on the poorest renters would both prevent and end homelessness. The Bipartisan Policy Center estimated that a scaled up program to provide vouchers to all eligible households that need them would cost about $31 billion per year. Some areas of the country also need to work on expanding the supply of rental housing. This could be done by expanding the National Housing Trust Fund, along with local efforts like your county's Affordable Housing Fund. But it's important to focus on the poorest renters, those with incomes below 30% of area median. Another way of increasing supply is by overturning exclusionary zoning. For example, reducing barriers to producing multifamily housing and reducing barriers to subdividing existing units. The housing affordability gap can also be closed by strengthening the income side of the safety net. For example, evidence shows that there's plenty of room to raise the minimum wage without a negative effect on the supply of jobs. The Earned Income Tax Credit works well for those who are able to work. SSI and SSDI disability income support could be raised to levels that make housing affordable for people with disabilities. More widely available low-cost childcare would reduce a barrier to working for families at risk of homelessness. Income volatility is also an issue. Washington's new Family and Medical Leave Act is great. We've all seen the effects of income loss in the current COVID crisis. Augmenting unemployment insurance and getting it to people quickly would help. An expanded housing choice voucher program would go a long way toward preventing homelessness, but we also need to work directly on social exclusion. We have evidence that vouchers work better. More people succeed in using them to find housing units in places that prohibit owners from refusing to rent to a household simply because the household will be using a voucher to pay part of the rent. You have such a law here, but it would be good to have a national law. We also need better enforcement of the national fair housing laws that are already on the books. We know how to end homelessness. We know what causes it. We know how to help people leave it. We know how to prevent it. What it takes is political will. Homelessness is a choice, not by people living on the streets, but by the rest of us when we turn the other way.